May I invite then Androniki Naska to speak about the Greek National Survey on Health and Nutrition, and then we have questions later on for Christina as well. Androniki is also at the Athens Medical School, the University of Athens. Please.
Thank you, Mr. Chair. Distinguished colleagues, ladies and gentlemen, good morning. I felt deeply privileged and truly honored when I received the invitation to contribute to this memorable event and honor our teacher, as Christina rightfully said, our professor, Dimitrios Trichopoulos. Let me also convey the gratitude of all members of our research team back in Athens, whom I represent here today. My speech will refer to the recently concluded National Survey on Health and Nutrition, also known as the HYDRIA Project. Since the 80s, Dimitrios and Antonia realized a gap of knowledge on the health and nutritional status of contemporary Greeks. Indeed, at that time, the starting prosperity of the country, the advancement of food science, the development of new technologies, led Greeks to experience, in the years that followed, profound changes in their eating behavior and a gradual decline of their advantageous position in relation to other European populations. Yet, it was 2012 when the Hellenic Health Foundation received support to implement the HYDRIA study, a targeted action to develop and apply methods to collect diet and health-related data. And interestingly enough, we received the support during the period of the financial recession. But let me say that this delay was to our benefit. Firstly, we were far more experienced in 2012, in comparison to what we were in the 80s or even the 90s. And secondly, and even more importantly, the timing for collecting this type of data was perfect. The country was already facing the impact of the most critical financial crisis in its modern times. So, the HYDRIA project aimed to collect high-quality data representative of the population to study and to evaluate the health status, the dietary and the lifestyle choices of the population in Greece, so as to plan, implement and monitor public health policies, to extract information on important indicators which will enrich the Health Charter, a database of the Greek Ministry of Health, to develop plans for the undertaking of future studies, and also to establish an integrated network based on local health centers for the collection of health, diet and lifestyle data. In Europe, and in the European Union in particular, we are very much interested in applying methodologies that will generate comparable results. So in our preparatory phase, we gave particular care to develop methods aligned with the European recommendations. For this, we participated in the network of the European Health Examination Surveys, coordinated by the National Institute for Health and Welfare in Helsinki, and also in the pilot phase of the EU menu, also known as What's on the Menu in Europe, an initiative of the European Food Safety Authority. Through our participation in these two networks, we became familiar with the know-how of Northern Europeans and Scandinavian countries, but also, and more importantly, we received support to develop and pilot test our methods and procedures. And of course, it would be an omission if I didn't mention the experience we accumulated through the 90s while we were participating in the EPIC baseline data collection. So, from September 2013 until December 2014, 5 fieldwork teams were visiting all regions in the country and recruited 4,011 individuals aged 18 years and over, permanent residents of Greece, and selected through a 2-stage stratified random sampling. The table presents the distribution of the study sample by gender, by age groups, in comparison to the population in Greece. Overall, the sample is equally distributed among genders, between the two genders, and it also provides a representative picture of the population in Greece. Nonetheless, we had a low response rate among individuals above 75 years of age, and particularly among the female senior citizens. Before starting the data collection, we informed the target population, and for that, Professor Trichopoulos prepared a message which was broadcasted on all national channels, inviting the general public to participate. We also had launched articles in the local press, TV shows, and discussion with the local authorities and the local communities to explain them the impact and the objective of the study. The data collection started, of course, with a signed informed consent to participate, and it included the collection of detailed information on the participants' personal characteristics, medical history, lifestyle choices, eating out habits. The dietary intake data included the collection of 2 24-hour recalls, one on the day of the first examination and the second one 15 to 30 days afterwards via a phone interview. The collection of the dietary intake data also included the collection of a non-quantitative food frequency questionnaire. All the questionnaires were online, face-to-face interviews with special trained personnel, but we also collected measurements of blood pressure and pulse, and also measurements of height, weight, waist and hip circumferences, and of course we collected blood samples. I will not bore you with the methodological details, but please allow me to spare just one slide to present to you the Hellenic Health Foundation Nutrition Tool, the online application we used for the collection of the 24-hour recall data. This is one of the milestones of the small successes surrounding the HYDRIA study, as it is the first and up to now the only available tool which has been designed to particularly address the Greek population, as, among other things, it includes 170 picture series of Greek foods and complex dishes which have been developed and validated among the Greek population to be used as portion anchors. We presented our first results 2 months ago, so for the remaining of this presentation, I will share some of these results with you. In relation to obesity, we had indications that overweight and obesity are important public health problems in Greece. Now we have quantitative data, and indeed, about 70% of our population are either overweight or obese. Males are more frequently overweight, whereas females are almost equally often obese or overweight. The table describes the mean values and the quartiles of BMI, waist circumference, and waist to hip ratio. And very briefly, 25% of our population, according to the WHO cutoffs, are at increased risk of metabolic complications because of obesity and central obesity in particular. Diabetes mellitus. 10% of the population reported suffering of diabetes type 1 or type 2. And according to the levels of glycated hemoglobin, the blood samples, 11.3% of the population are pre-diabetics and 4.4% are diabetics. Hypertension. For these results, hypertension was defined as systolic blood pressure above 140 millimeters of mercury or diastolic blood pressure above 90, previous diagnosis of the condition, or current use of medication, or any combination of the above. An individual was judged as aware of his condition when he reported a previous medical diagnosis, and blood pressure was considered as control when levels were below the cutoffs for systolic and diastolic blood pressure. 42% of the population are hypertensives, Among those, 23% were not aware of their condition. And among those who were aware, about 40% did not have their blood pressure levels controlled, based, of course, on the measurement of one single day. Dietary intakes. The graph presents the mean daily intakes of foods and beverages for individuals below 65, these are the blue bars, and above 65, these are the red bars. The results are crude intakes. We have not started yet the full analysis of the dietary intake data, but I decided to present them to you because we could note some very interesting patterns and trends. The diet of contemporary Greeks consists of cereals, of dairy products. Olive oil is still the predominant added lipid. Vegetables are also quite high, but high is also meat intake, particularly among the younger generations, and it is also substantially higher than what it used to be in the 60s. Notwithstanding the fact that the results are not energy adjusted, as I said, I'm sure you will keep me right in saying that what we can see from this graph is that the individuals who more adhere to the traditional Mediterranean diet are those above 65, who consume more vegetables, far more fruit, more pulses, less meat, more fish, but also they prefer wine over beer, a characteristic of the Mediterranean diet which appears to have been lost among the younger generations, who reported that they almost equally consume wine and beer. 42% of the daily energy is provided from fat, and among those 42, 20% comes from monounsaturated fatty acids, reflecting probably the high olive oil intake, but also 13% comes from saturates. We are now extending our data collection to include also adolescents, children, and breastfeeding mothers, and if you wish to retrieve more information, you can visit our website. When you open the home page, at the left-hand side corner, you will be able to follow the message inviting participants prepared by Professor Trichopoulos and broadcasted, as I said before. Professor Trichopoulos, through his calm and knowledgeable voice, was always for the Greeks a force to be reckoned with. And indeed, the vast majority of the HYDRIA participants, when were asked what was their motive to participate, most of them said that it was the message of Professor Trichopoulos that influenced their decision. Closing, I'd like to acknowledge my colleagues in Athens who worked in the HYDRIA study under the coordination of Androniki Trichopoulos, the Hellenic Statistical Authority for helping us with the derivation of the study sample, the study participant, and of course, our professor. Professor Trichopoulos was our mentor in planning and implementing the study. And actually, among the audience, several will recognize his handwriting on this page. It was his notes one day before. We were close to the data collection, and at that day we started discussing the first food classifications. In the picture, he's with Philippos, the statistician of the HYDRIA study. I'm so sorry. Thank you for your attention.
Thank you very much, Androniki. May I invite Christina also over? I would like to congratulate you with your talks, in very difficult times in Greece, keeping on with the Hellenic Health Foundation and with all your work. This, of course, applies to all of you working in Athens, and I congratulate also very much Antonia with this. May I invite questions or comments? Walt, Dr. Willett.
One wondering, in the Chances study, did all of the centers have dietary data?
Excuse me, if we had dietary, yes.
All the centers do.
Yeah.
Great.
But it was rather difficult, as you may imagine, to harmonize those. But yes, they provided data.
I observed that in one of your last slides you showed from the HYDRIA study that the habit from drinking wine to beer, you took over the habits of the barbarians of the north. Had that been observed, and is that a trend that you see more?
You mean whether it has been observed in other studies as well?
Yes.
I'm not aware of any study of this scale, recent study in Greece, that would provide you additional evidence confirming this finding. But we were suspecting many of these findings. Of course, it was obvious in the streets that our population is now overweight or obese. And we could also see from other data coming from small-scale studies or information collected at household level that the eating habits of the Greeks have changed. And also an aspect that I didn't mention is also physical activity, and we have very detailed data on physical activity as well, which is quite low among the Greek population. So all this combined, and the influence that the younger generations, the trendsetters, younger generations, are receiving, I think we have a lot of work in relation to public health now in Greece.
Well, thank you very much. I'm quite sure that's very good in your hands. Thank you.
Bert,
Now, yes. Oh, we have a final question.
Okay,
Please, go
thank
ahead.
you very much.
Yes,
Yeah,
sorry
hi,
about that.
I'm Donna Spiegelman from the Department of Epidemiology, and I wanted to thank all of the panelists for telling us all about the breadth and depth of the work that Dimitrios was involved in as both starting and facilitating in Greece and in Europe, which here on the US side, I've been very aware of his work that's been connected to things in our own department, but really I haven't understood the full extent of everything he's been doing in Europe and Greece. So thank you so much for explaining all of that to us. And then I had sort of more of a scientific question, although I'd like to preface it by saying I'm a statistician, so it could be a naive question, but I was impressed by the data of the very high rates of obesity and overweight that you're seeing in Greece. And then at the same time, we hear a lot about, and there's a really strong evidence for the Mediterranean diet. And I was wondering, and it looked to me like maybe the diabetes rates were maybe lower than we might expect, given the high obesity and overweight. So I was wondering what thoughts you had about sort of the interplay between, say, the proclivity to what we consider to be possibly the healthiest diet that there is, which originates in large part in Greece, with very high rates of obesity and overweight, and what impact that has on mitigating chronic disease and so forth.
Well, I think the reply lies already in the slides. The Greeks, the young Greeks, do not follow the Mediterranean diet. As simple as that. And as I said, we are not physically active anymore. In the 60s, when the Mediterranean diet was launched, meat intake was very low. People were walking from one village to the other to get the bus. This is now gone. And that we see in the health indices in this cross-sectional study. Now, the interplay. Again, I would reply that all these are very welcome ideas for us to study in the future. Of course, we need to see the results by age group, by other factors associated, but I would agree with you. I would expect maybe the levels of diabetes to be higher, but we started with, in our initial study plan, we had fasting glucose, but then we realized that it was a very difficult sample to collect. And thanks to Antonia, we managed to find the funding and to move to glycated hemoglobin, which is far more expensive. So I think we have valid data in our hands to study all the hypotheses that can be raised.
Thank you very much. Yes, Elio, final question?
Christina, that is a comment and a question. I think it's extremely important that you have been able to conduct this study, which, for its importance, the depth, the information you have collected today in Greece, because what may look as a surprise to some of colleagues in the audience is that what we are observing, and you are showing this very clearly, is a long-term trend of something that started maybe 20 years ago. Already in EPIC, with data collected in the 80s, it was absolutely clear that BMI was higher in Southern Europe, in Spain, south of Italy, and Greece, compared to Central Europe and compared to Northern Europe. So there was a north-south gradient in BMI. It was not that dramatic. Now, recent data I've seen from Italy and from Spain says that this difference has probably gone even stronger now, is even more evident. And so we do have an epidemic of obesity in the Mediterranean area, European Mediterranean area. And we do not have too many studies that give us a good explanation of why we have such an epidemic of obesity. There are plenty of suggestions, shift from a mainly rural life to urban life, decrease in energy expenditures, different type of transport, bicycling and walking was very common in the rural area until 20, 30 years ago. It's not anymore. Abundance of food, despite whatever you can say about economics. So there are all these.
Elio, now perhaps
but we do not know yet what would be the health impact, because it has been so recent. And this is why your study is so important, because we need to understand what will happen.
Thank you for this comment. I'm quite sure you agree with this. So with that,